MSF stands for multi-source feedback. It's a way of sampling the opinions of colleagues on the clinical performance and professional behaviour of a practitioner. MSF has been used by a number of health professions in the past and is well established. It's also often referred to as 360-degree assessment. MSF provides information to enable reflection on performance and feedback to inform self-evaluation. Formative guidance is provided during feedback by a named educational supervisor. In the Foundation Pharmacist programme, MSF should usually take place 6, 11 and 15 months into the programme. Different tools can be used, including Mini-PAT. The one used in Foundation Pharmacist training and in many other areas is Mini-TAB, so we will cover TAB in detail in this module. TAB stands for Team Assessment of Behaviour. Mini-TAB has two main purposes. The first is to provide evidence that the Foundation Pharmacist is performing at the expected standard or exceeding this level. The second is to enable below expected performances to be identified and recorded. Action can then be taken and subsequent progress monitored. Mini-TAB is usually first carried out after 6 months and subsequently at 11 and 15 months. But if there are any concerns about a practitioner, it can be repeated more frequently. The Foundation Pharmacist should nominate 6 to 10 colleagues to assess them by completing a Mini-TAB form. This can be done on paper or electronically. Copies of the form can be downloaded from the University of Kent Moodle website. The electronic version can be accessed through the KSS Deanery Pharmacy website. The assessors should be members of the healthcare team that the Foundation Pharmacist has been working with in the last few months. They don't need to have been specifically trained in supervised learning events and assessments of practice, although it is often helpful if they have been. The recommended mix of assessors is essential: 1 to 3 other healthcare staff that the practitioner works with in a clinical setting. These could be doctors, nurses, allied healthcare professionals or ward clerks. Ideally, there should be a mix of professions. 2 to 4 pharmacy colleagues that the practitioner works with. These could include pharmacy technicians and specialist pharmacists. Stage 1 Foundation Pharmacists cannot be assessors. 1 to 2 practice supervisors. There may have been more than one, depending on the rotational program of the practitioner in the last 6 months. There is the option for including 1 to 2 trainees if the Foundation Pharmacist has been supervising or managing any trainees during the last 6 months. In addition, the Foundation Pharmacist must complete a self-assessment Mini-TAB themselves.
What I've done is I've done a printout for you and Mum.
Multi-source feedback can demonstrate fitness to practice or provide evidence to suggest that someone may be unfit to practice. Specific information can be collected about what a practitioner actually does on a day-to-day basis. The collated information is a powerful tool to initiate changes in behaviour.